Throughout and now on the other side of the pandemic, Canada's healthcare sectors were bombarded and are now playing catch up. Whether it's wait times for surgeries, emergency rooms, or room closures altogether. Joining the program this morning to speak about how technology can help improve Canada's healthcare system is Medimap CEO Thomas Jankowski. Good morning, Thomas.
Good morning, Brendan. How are you?
I'm doing great, and thank you so much for being here this morning. And so, Thomas, I'd like to begin with what sort of tech could make the biggest impact on wait times that have skyrocketed not only here in Saskatchewan, but across the country as well?
The two things that come to mind right away are any type of tech that can help load balance the entire system and sort of maximize that marginal capacity that still exists in the system. So when you think about the actual problem, on the load balancing side, we don't really see end-to-end what's happening in healthcare. You might be choosing to go for a headache to an emergency room, but there might be a pharmacist next to you that's actually available to help you with the problem, or a licensed nurse, or a walk-in clinic with half-hour wait time that could have helped you. But you don't see any of that because we don't have any systems right now that are sponsored by the government that sort of expose that to the general public.
Now, Thomas, that leads perfectly into my next question. Medimap has been implemented in Winnipeg to help direct those with low acuity cases from unnecessarily clogging emergency rooms and directing them to nearby walk-in clinics. What can something seemingly so simple do to decrease the burden on our hospitals?
Yeah, it's actually a really good question, Brendan. We're seeing quite positive outcomes of people that actually choose to reroute themselves to nearby clinics as opposed to occupying that emergency room space for minor low acuity cases. I think if this was rolled out nationally, we would see tremendous impact, and we'll be publishing a case study that actually speaks to some of the early results we're seeing in Winnipeg.
And Thomas, I guess, how long will you have to see or have this the Medimap implemented before we could maybe see the first rendition of these study results?
We've been in place for coming up on 6 months. So while the pilot is scheduled to take place for another 6 months, I think we can already share some early results, which again are quite promising, and think about how to implement this at scale, because the numbers are quite telling, and I think we can do better. Right now, our system still relies on you logging into Winnipeg's website and sort of making your own choice as to where to go, whereas we can actually improve the system to tell you based on your symptoms where you should go, sort of similar to how you speak to a triage nurse when you first encounter an emergency room admission, that sort of thing. So if we can streamline the system, I think we can eke out almost double percentage digits in terms of the improvement that we'll see in terms of freeing up space at ERs.
Now, Thomas, we just have under a minute left. Thank you so much for your time this morning. But I'd like to know, what difference can a greater implementation of technology make for our healthcare workers who are overburdened and really feeling the burnout coming out of the pandemic?
100%. I think for workers, it's about giving them some sort of flexibility as well. Our system, for example, is capable of integrating virtual care solutions into our mainstream offering. So when you think about it, in many cases, if it's a low acuity case, virtual care is the right solution. So how about allowing healthcare workers to log in from home for a couple hours a day to help solve those easy cases through a virtual care solution? That's definitely possible, and it would make their lives a lot easier.
Well, Thomas, thank you again so much for taking the time to join us here this morning.
Thank you, Brandon. My pleasure.